Old age is a time when many people wish to live peacefully, enjoy life with their children and grandchildren, garden, read books, or simply wake up every morning without rushing. However, for many seniors in the United States, that peaceful dream is often shattered by three haunting words. You have cancer. According to the National Cancer Institute (NCI), nearly 60% of new cancer cases diagnosed each year occur in people aged 65 and older. And what is more worrying, many types of cancer in the elderly do not have obvious initial symptoms. By the time they are detected, the disease is already in a late stage. Therefore, many people consider cancer an inevitable part of aging. But the truth is different. Cancer is not fate. Many types of cancer are completely preventable if we understand the causes correctly, know how to monitor our bodies, and change our lifestyles promptly. James Miller, 68, of California, smoked for 40 years and always thought that illness was an inevitable part of aging. But after a routine checkup and hearing his doctor tell him that he was on the fastest path to lung cancer, he decided to quit smoking, exercise lightly every morning, and maintain a healthy diet. Now, after 3 years, his lungs are clear, his physical condition is good, and more importantly, he is confident that he is taking control of his health. James's story is not unique. In today's video, we will learn about the 5 most common cancers in the elderly, and more importantly, how you and your loved ones can prevent these diseases right now. 1. Colorectal cancer, the silent killer and completely preventable. Colorectal cancer, also known as colon cancer, is one of the most common cancers in the elderly worldwide. In the U.S. alone, more than 150,000 new cases are diagnosed each year, and the majority of them occur in people over 60 years old. It is worth noting that this is one of the most preventable and early detectable cancers if the patient is properly screened. But in reality, many people miss out on the golden opportunity simply because they do not know they have the disease or ignore the early signs. In the early stages, colorectal cancer rarely causes obvious symptoms. Patients can still eat and live normally, only feeling a little tired, irregular constipation, or feeling slightly bloated after eating. These signs are often attributed to old age, causing many people to not go to the doctor. By the time obvious symptoms appear, such as prolonged abdominal pain, bloody stools, unusually small and flat stools, or unexplained weight loss, the tumor has progressed to a late stage. What's more worrying is colorectal cancer doesn't form suddenly. It usually starts with small polyps in the intestines, benign tumors that grow on the lining of the colon. Over many years, if not detected and removed, some of these polyps can turn malignant and become cancerous. The good news is, if polyps are detected early through endoscopy, the doctor can remove them during the examination without major surgery, which means eliminating the risk of cancer right from the start. So, how can we prevent this dangerous type of cancer? The answer lies in regular screening and lifestyle changes. For people aged 50 and over, especially those with a family history of gastrointestinal cancer, regular colonoscopy every 5 to 10 years is the most important step to protect your health. Endoscopy can detect and remove polyps very early, even before they become cancerous. For those who cannot undergo endoscopy, the doctor may prescribe a stool test for occult blood, a simple but effective cancer screening method if performed annually. In addition, diet plays an extremely important role. A lifestyle rich in green vegetables, fruits, whole grains, and low in red meat and fried foods is a significant protective factor. Studies have shown that people with a high-fiber diet and regular exercise have a 30 to 40% lower risk of colorectal cancer than people who are sedentary, eat a lot of fatty meat and processed foods. Maintaining a reasonable weight, controlling blood sugar and blood pressure also help reduce the risk of the disease. In addition, habits such as smoking and drinking a lot of alcohol should also be eliminated. Smoking not only causes lung cancer, but also increases the risk of colorectal cancer in a silent but powerful way. Alcohol, when consumed in excess, can damage the lining of the intestines and contribute to the growth of polyps. Phenol. The most important thing is to listen to your body. If you notice any signs such as changes in bowel habits, blood in the stool, persistent bloating, or unexplained weight loss, don't delay. See your doctor and get the necessary tests done. Early detection not only helps with effective treatment, but also helps you avoid serious complications later on. Colorectal cancer is a silent killer, but it is not impossible to prevent. With initiative, understanding, and timely action, you can protect yourself and your loved ones from this dangerous disease. 2. Another important measure is regular lung cancer screening, especially for people over 50 who have smoked for a long time. Currently, low-dose CT scan is the recommended method in many countries for high-risk groups. This is a modern imaging technique that helps detect small lesions in the lungs early before they turn into dangerous stages. If detected early, the 5-year survival rate can be 4 to 5 times higher than if detected late. In addition to quitting smoking and screening, a healthy lifestyle plays an essential role in preventing lung cancer. A diet rich in fresh vegetables, fruits, antioxidants such as beta-carotene, vitamin C, E, combined with regular exercise, adequate sleep, and a relaxed mind will help improve resistance, protect the lungs from harmful factors. Light activities such as walking, deep breathing exercises, meditation, or yoga not only improve respiratory function, but also help the elderly live healthier every day. The important thing is, never take a persistent cough lightly. If you have a cough that lasts more than 3 weeks, especially a dry cough, cough with bloody phlegm, accompanied by weight loss, difficulty breathing, or chest pain, go to a medical facility for a checkup. Delaying can cause you to miss the golden opportunity to detect and treat the disease when it is still controllable. Lung cancer is a serious disease, but you can completely prevent it. Starting with a small action today, such as quitting smoking, changing your living environment, and going for regular health checkups, is how you protect yourself and maintain healthy breathing for your old age. Lung cancer, a silent danger, and how to prevent it for the elderly. Lung cancer has long been known as one of the most dangerous cancers for humans. In the elderly, this is not only a common disease, but also the leading cause of cancer-related deaths. In the U.S., more than 70% of lung cancer diagnoses occur in people over 65 years old. What makes lung cancer especially dangerous is that it often develops silently, without obvious symptoms, until it is in the late stages. For many people, especially those who have smoked or lived in a polluted environment, early symptoms, such as persistent cough, hoarseness, shortness of breath, or chest pain are often overlooked. It must be a sore throat. It's just a cough due to the weather. These excuses cause many people to delay going to the doctor. Meanwhile, symptoms such as coughing up blood, unexplained weight loss, or persistent shoulder or chest pain often appear when the cancer has metastasized. However, there is a hopeful truth. Lung cancer is preventable, and survival is significantly improved if the disease is detected at an early stage. The biggest risk factor for lung cancer is smoking. Whether it is traditional cigarettes, pipe tobacco, or e-cigarettes, the toxins in cigarette smoke damage the lungs and accelerate the formation of cancer cells. Smokers are 15 to 30 times more likely to develop lung cancer than non-smokers. Even non-smokers who live with smokers, that is, passive smokers, are at higher risk than normal. Therefore, quitting smoking is the most important preventive measure. It is never too late to quit. Studies show that if you stop smoking at age 60, your risk of lung cancer can be significantly reduced within 5 to 10 years. In addition, avoiding exposure to air pollution, toxic dust, or industrial chemicals, such as asbestos, radon, etc., is also an important factor in protecting your lungs. Another important measure is regular lung cancer screening, especially for people over 50 who have smoked for a long time. Currently, low-dose CT scan is the recommended method in many countries for high-risk groups. This is a modern imaging technique that helps detect small lesions in the lungs early before they become dangerous. If detected early, the 5-year survival rate can be 4 to 5 times higher than if detected late. In addition to quitting smoking and screening, a healthy lifestyle plays an essential role in preventing lung cancer. A diet rich in fresh fruits, vegetables, antioxidants such as beta-carotene, vitamin C, E, combined with regular exercise, adequate sleep, and a relaxed mind will help improve resistance and protect the lungs from harmful factors. Light activities such as walking, deep breathing exercises, meditation, or yoga not only improve respiratory function, but also help the elderly live healthier every day. Important. Never take a persistent cough lightly. If your cough lasts longer than 3 weeks, especially if it is dry, has blood in it, is accompanied by weight loss, difficulty breathing, or chest pain, go to a medical facility for a checkup. Delaying can cause you to miss the golden opportunity to detect and treat the disease when it is still manageable. Lung cancer is a serious disease, but you can completely prevent it. Starting with a small action today, such as quitting smoking, changing your living environment, going for regular health checkups, is the way you are protecting yourself and maintaining healthy breathing for your older years. 3. Skin cancer. A disease that is easy to ignore but cannot be ignored in the elderly. When talking about cancer, many people often think of the lungs, liver, intestines, or breasts, but forget that the skin, the largest organ in the body, can also become the starting point of dangerous cancers, especially in the elderly. In particular, skin cancer, especially malignant forms such as melanoma, is common, but is often overlooked because it appears silently, is painless, and is easily confused with age spots, moles, or skin damage due to aging. In the U.S., more than 5 million cases of skin cancer are diagnosed each year, and the risk of the disease increases significantly with age. The main cause: the accumulation of harmful effects of sunlight over decades of living and working. For the elderly, those who have spent their whole lives exposed to sunlight without having the habit of protecting their skin, this risk is even more obvious. Even more worrying, melanoma, the most dangerous form of skin cancer, can spread very quickly if not detected and treated early. Although it accounts for only about 1% of all skin cancers, melanoma causes the majority of deaths. Vulnerable areas include the face, neck, ears, back of the hands, and forearms, areas that are often exposed to the sun and that older people often pay little attention to. The danger is that many people do not realize that they have signs of skin cancer. A mole that changes color, a small sore that does not heal, an unusually dark patch of skin, can all be early warning signs, but they are often considered age spots and ignored until the damage spreads or starts to cause pain. The good news is, skin cancer is one of the most preventable cancers if you have the habit of protecting your skin early and monitoring small changes in your body. So how can you prevent it? First, protect your skin from ultraviolet UV rays, the #1 risk factor for skin cancer. UV rays can penetrate clouds and even glass. Therefore, even if it is cool or cloudy, the elderly still need to cover up carefully when going out. Use a broad-spectrum sunscreen with an SPF of 30 or higher, and reapply every 2 hours when exposed to sunlight. In addition, wearing a wide-brimmed hat, long-sleeved shirts, and limiting sun exposure between 10 a.m. and 3 p.m. are effective ways to protect aging skin. Second, check your skin regularly, both at home and with a dermatologist. Self-observing your skin from head to toe once a month will help you detect unusual changes early. Note the ABCD rule of suspected cancerous lesions. A. Asymmetry. Moles are not symmetrical. B. Border uneven, torn or blurred edges. C. Color uneven color. D. Diameter. Diameter greater than 6 millimeters. E. Evolving. Changes in size, color, or feel. If you have any of the above signs, do not hesitate. See a dermatologist for skin examination, biopsy, or close monitoring. Third, build a healthy lifestyle to strengthen the immune system and natural resistance of the skin. Supplementing foods rich in antioxidants, such as vitamin C, E, beta-carotene, found in carrots, oranges, green vegetables, drinking enough water, getting enough sleep, and avoiding prolonged stress are all factors that help the skin recover and prevent malignant lesions. And finally, never think you are old. So what are you worried about? It is this subjective mentality that causes many people to discover the disease too late. Old age is not the end of self-care. Every small action, applying sunscreen, covering up when going out, monitoring strange spots, is a way for you to proactively protect your life and quality of life. Skin cancer is not scary if you know how to prevent it and listen to your body. Start today. And how to prevent it. Prostate cancer is one of the most common cancers in men, especially those over 60. In the U.S., 1 in 8 men are diagnosed with the disease during their lifetime. Although this is a slow-growing cancer with a high survival rate if detected early, in reality, many men only know about the disease when complications arise, because they have no symptoms or are subjective to the initial vague signs. The prostate is a small gland located below the bladder, surrounding the urethra, the tube that carries urine out of the body. When a tumor develops here, the patient often experiences problems related to urination, such as frequent urination at night, weak urination, urgent urination, or the feeling of incomplete urination. However, these symptoms are easily confused with prostate enlargement, a benign condition that is very common in the elderly. This confusion causes many people to delay examination and screening. Some cases do not have any symptoms, and cancer is only discovered by chance during a general health check. But if not detected early, prostate cancer can spread to the bones, lymph nodes, and other organs, causing pain, weakness, and significantly reducing life expectancy. So how can this disease be prevented? First of all, the most important thing is regular screening, especially for men aged 50 and over, or from 45 if a relative has had prostate cancer. The two most common screening methods are 1. PSA, prostate-specific antigen test, a blood test that detects the concentration of prostate-specific antigen. Elevated PSA levels can be a warning sign of cancer, although it is not always cancer. 2. Digital rectal exam diary. The doctor inserts a finger into the rectum to check the size and firmness of the prostate. Although these are simple tests, many people hesitate or delay them because of embarrassment, fear of pain, or lack of information. But remember, just a few minutes of testing can help you avoid a painful treatment process later. 5. Breast cancer, a silent danger in older women and effective prevention methods. Breast cancer is a nightmare for millions of women around the world. This is the most common cancer in women and is also the leading cause of cancer death in women. One of the little-known facts is that the risk of breast cancer increases significantly with age, especially after age 60. In the U.S., the majority of breast cancers are diagnosed in women aged 55 and over. However, many people still mistakenly believe that old age means no more risk. This is a dangerous misconception. Older age does not reduce the risk of breast cancer. On the contrary, hormonal changes, aging breast tissue, and the accumulation of risk factors over time make older women more susceptible to the disease. Sadly, many women in this age group no longer have regular checkups, do not regularly self-examine their breasts, and are also prone to being subjective when they see unusual signs. Early breast cancer is often painless and does not cause obvious sensations. A small tumor can grow silently for months without the patient knowing. By the time it is detected, the disease may have spread to the lymph nodes, bones, or lungs. Symptoms to pay special attention to include a palpable tumor in the breast or armpit, a change in the size or shape of the breast, an orange peel-like dimpling of the breast skin, unusual nipple discharge, especially bloody, or a nipple that is pulled inward. The biggest problem is procrastination. Older women are sometimes reluctant to go for a checkup, or think that if they no longer have periods or give birth, they don't need to care about their breasts. Some even have the mentality of, if you're sick, don't care. This subjectivity is the reason why many cases of breast cancer in the elderly are discovered too late, reducing the chance of effective treatment. So how can we prevent or detect this disease early? First, regular screening is key. The American Cancer Society recommends that women aged 50 to 74 should have a mammogram every 2 years, or annually if they have high risk factors, such as having a mother or sister who has had the disease. Mammography is the simplest but most effective method to detect small tumors before symptoms appear. Second, practice monthly breast self-examination. Every woman needs to get familiar with her body, observe and feel her breasts and armpits regularly, especially after her period or on a fixed day each month if she has gone through menopause. If you notice anything unusual, no matter how small, don't wait to see your doctor. Third, make lifestyle changes. A healthy diet low in saturated fat, rich in fruits and vegetables, maintaining a healthy weight, exercising regularly, and limiting alcohol can help reduce your risk of breast cancer. Avoiding long-term hormone replacement therapy after menopause, unless strictly prescribed by your doctor, can also help reduce your risk. Equally important is the mental factor. Older women sometimes pay less attention to themselves because they have been used to taking care of others all their lives. But remember, taking care of your health is a gift you give to yourself and your loved ones. Early detection of breast cancer can bring a chance of cure of over 90%. Age does not make you immune to breast cancer, but knowledge, initiative, and self-love will be the most powerful weapons for you to live a healthier, more peaceful, and more fulfilling life every day. Old age brings experience, calmness, and precious moments with children and grandchildren. But at the same time, it is also the stage when the body becomes more sensitive to diseases, especially cancer. Fortunately, not all cancers come suddenly and cannot be controlled. As we have learned together, the 5 common cancers in the elderly, including colorectal cancer, lung cancer, skin cancer, prostate cancer, and breast cancer, all have one thing in common. They can be prevented or detected early if you are proactive. Take a few minutes each month to do a self-examination. Spend 1 session each year for a screening. Adjust your lifestyle, diet, exercise, and listen to your body. All of these seemingly small things are the shield that helps you live a healthy, safe, and independent life for a long time. Remember, early detection, the chance of survival is many times higher. If this video is useful, don't forget to share it with your relatives, friends, especially your aunts, uncles, and grandparents, for a healthier, more proactive, and fulfilling old age every day. Gue Wai Kien Fan Hoi. Bang Ju Kien Ben. Kak Ban Dike De Tu Kien. Equally important is the mental factor. Older women sometimes pay less attention to themselves because they have been used to taking care of others all their lives. But remember, taking care of your health is a gift you give to yourself and your loved ones. Early detection of breast cancer can bring a chance of cure of over 90%. Age does not make you immune to breast cancer, but knowledge, initiative, and self-love will be the most powerful weapons for you to live a healthier, more peaceful, and more fulfilling life every day. Old age brings experience, calmness, and precious moments with children and grandchildren. But at the same time, it is also the stage when the body becomes more sensitive to diseases, especially cancer. Fortunately, not all cancers come suddenly and cannot be controlled. As we have learned together, the 5 common cancers in the elderly, including colorectal cancer, lung cancer, skin cancer, prostate cancer, and breast cancer, all have one thing in common. They can be prevented or detected early if you are proactive. Take a few minutes each month to do a self-examination. Spend 1 session each year for a screening. Adjust your lifestyle, diet, exercise, and listen to your body. All of these seemingly small things are the shield that helps you live a healthy, safe, and independent life for a long time. Remember, early detection, the chance of survival is many times higher. If this video is useful, don't forget to share it with your relatives, friends, especially your aunts, uncles, and grandparents, for a healthier, more proactive, and fulfilling old age every day.